Hey, everybody. I'm using this new platform here, this new version of Facebook Live. Anyway, happy Monday. So glad you're here, or you will be here to watch this just a little bit later. Let me go down a little bit. I want to share something that has come as a result of some of the other lives that I've done, specifically last week, which would provide you with an opportunity to reach out to either active patients or clients or prospective patients or clients in order to have a conversation about what's on their mind, what's worrying them, what they need, what they want your help with, etc. And so this is just a quick Facebook Live here for me to share with you that when you're on the phone with someone or you're meeting them, maybe you're meeting them if you're a chiropractor, you're probably going to see them in person too. There's a really good chance that when they ask you for your help, your advice, your direction, and you're providing insight, answers, clarity, direction, solutions, whatever makes sense for you and the people that you're talking to, when you're finished with that conversation, and I want to pretend for a second that it's on the phone. If you've reached out to someone that maybe you've emailed them or you reached out with a courtesy call and you're having a conversation with someone and you're providing that valuable, benefit rich advice, direction, whatever. When you get to the end of the conversation, I highly recommend that you ask them one last question before you go, before you hang up. And the question is, hey Bob, one last thing before we hang up. Can I ask you a question? Sure. And you say, a lot of my patients or a lot of my clients, whatever makes sense for you, keep telling me about people that they know, like friends, family members, coworkers, or neighbors, that have the same questions and problems or challenges that you did or that you do. Can I ask, do you know anybody like that? Now, the first thing that I want to point out to you is that you're not asking for a referral. You're simply asking them what I refer to as an I'm curious, or you can even say, I was just wondering. And what you'll be not so surprised to learn and hear me tell you is that about 80% of my clients and the people that I have that are using this and doing this, including some of you, by the way, that are just taking my advice or my ideas and running with them, which is perfect, you'll find that about 4 or 5 out of 10, let's be more conservative, about 4 out of every 10 say, you know what, I do. And I want to point out that the language, the dialogue that I just shared with you, when you actually spell out for them, friends, family members, coworkers, and neighbors, you are quite literally leading them down a path, guiding their thoughts about all of their friends, family members, coworkers, neighbors, to go through that Rolodex in their mind. If you're old enough like me to remember the old Rolodex, to go through that Rolodex in their mind to see if they've talked to or engaged with anybody in their life that had a similar question or challenge or issue like they did. Now, when those 4 out of 10 say, you know what, I do, your job is not to try to hard sell that your existing patient or client to get to their friend, their family member, their coworker, their neighbor. You simply want to ask, Bob, do you think it would make sense for me to talk to them and share the same advice with them that I shared with you? That's it. And you're going to get one of 3 different answers. You're going to get, yeah, I think that would be great. You're going to get, nope, I don't think so. Or you're going to get a maybe, let me think about it. Okay? So the yes is, what do you do with a yes? Again, don't try to pre-sell, pre-schedule, pre-close anybody. You're simply going to make them an offer. Well, Bob, if you connect us, or you let your friend or your brother-in-law, whoever it is, know that I'd be calling, I'd be happy to make that call a little bit later on this afternoon. They may say, you know what, let me reach out to them first, and then you'll follow their lead after that. If the answer is no, that's perfectly okay. Bob, I'm so glad to hear it. If you have somebody in your life that you think needs some additional advice or direction, you can absolutely feel free to tag me in. Perfect. And then, of course, you have the maybe or I don't know or let me think about it. Also a perfectly good answer. And the same answer is also true for that person. Bob, if you come up with someone and you think it would make sense to tag me in so that I can help them too, it would be my pleasure to do whatever I can for your cousin Joe. Whatever. That's it. It's short, it's sweet, it's simple. You'll never feel uncomfortable. It's warm and fuzzy because you're not coming out and asking for a referral. So I encourage you, as you continue this outreach effort, whether you're emailing, whether you're texting, whether you're making phone calls, or if you're seeing people in person and they're bringing you their issues, they're bringing you their challenges, or what they need help with or want help with right now. This is how you can leverage those interactions, those conversations in a way to reach even more people, touch and serve even more people. And of course, as a result of those conversations that you're having with their friends, family members, coworkers, and neighbors, you are going to acquire new patients or clients depending on who you are and what you do. I hope this helps. If you have any questions after this Facebook Live is over, this video is over, absolutely feel free to post a comment below, and I will answer that question when I see it. For now, I will say have a great rest of your day, and I look forward to talking with you soon. Bye for now.